The Health Exchange Marketplace it's actually a website that is offering health insurance for those who are uninsured. The government is offering, for those who qualify, to provide some assistance to help bring down the cost of their premiums. And the marketplace is a federally run exchange. They're calling it the exchange also, which basically is allowing those consumers who do not have health insurance or they're losing coverage to basically enroll using some assistance that the government's providing through either premium tax credits and or what we call cost share reductions. Those reductions are helping reduce parts of the insurance like deductibles, out-of-pocket maximums, and co-insurance. It's basically designed for people that have lost coverage or they've lost a job and now they need some type of health insurance because there is an individual mandate or a requirement by March 31st, 2014 that those who do not have coverage will face a penalty if they have not secured some type of health insurance that is basically it has to meet minimal standards for 2014. The next date that's critical is actually February 15th, 2014. If consumers want their coverage to start by March 1st, 2014, they need to basically enroll in a plan by February 15th. The most important date, I would say, at this particular juncture is March 31st. If consumers do not sign up by March 31st, 2014, they may face a penalty. That penalty is either $95 or 1% of their income, whichever is higher. We do get some people that actually are very concerned about the penalty, and what they have to remember is if they have to meet a certain level, a threshold, in order to qualify for the subsidies or the premium tax credits through the marketplace, and that level is the federal poverty level. If they do not meet the federal poverty level for their household size, they will not be subject to the penalty, and they will be exempt when they file their taxes at the end of 2014. Probably the biggest misconception with the launch in the last couple months is that the marketplace is not working. It's non-functional, and I would, at this point, I'm really, really happy to say it is almost working effortlessly. They've worked the bugs out of it, and it's just it really is a breeze to go through once you have all the information gathered and you're ready to submit that information online. Another misconception is that it's just for people with chronic health conditions, and that is not the case. I've seen so many clients that literally were in tears coming into my office because their coverage was so unaffordable, and I just would love to just share with the general public that the marketplace has helped a tremendous number of people, especially those that had pre-existing conditions, and now the pre-existing condition requirements are gone. The insurance companies have to accept everyone, basically, which is great news. The other misconception out there is that this coverage, even through the marketplace, is unaffordable, and that is totally incorrect. After the subsidies are basically, the eligibility comes out, most people that I have assisted have it's really assisted with them making their coverage something that they can fit into their monthly budget. Community Action basically received a federal grant to provide assistance through the Navigator program to assist consumers, guide them through the process. There are a lot of questions. People are unsure of what is the marketplace. They may have difficulty with computers. There's all sorts of rules and regulations and deadlines, and we're here to basically provide that assistance. We take them in, provide an orientation, what the marketplace is all about, to see if they qualify. I'm a navigator. I also have on staff 3 what we call CACs. Those are certified application counselors. These wonderful volunteers are also helping me work with the clients to get them educated, and also if they qualify to enroll in the marketplace. There are several different ways to actually get health insurance through the marketplace. The first is very simple. You could call Community Action. We could help enroll, answer any questions. You can certainly call the marketplace. They have a 1-800 number that they are fully staffed 24/7 to answer questions, and they can actually enroll people through the telephone. We're also seeing many people, the younger people that are computer savvy, they can go to healthcare.gov. They basically take a couple minutes to actually create an account. They need to have an email address, and after they've enrolled, provided some information, then what we've been experiencing lately, we're seeing eligibility results come up immediately, and after eligibility you can move on essentially to the plans. We also have local agents in the community that are actually certified through the marketplace. You can go to a certified agent and have them assist you. The most important thing is really to have all their information ready, so when they come and talk to either a navigator, or they talk to someone at the 1-800 number, or they talk to a certified insurance agent out in the local community, is to have some information concerning your income. You're trying to project what your 2014 income would be, and that's figured as at the modified adjusted gross. Okay, it's a little complicated, but if you just look at gross income before taxes are taken out, that's probably the easiest way to think about it. If you have an email address, you're going to need an email address to actually create an account. And if you don't have an email address, that's okay too. You can basically enroll over the phone and have all the information sent to you from the marketplace through mail, or you can have this information sent to you at an email address. And the other information would be an employer. The employer's telephone number, address is also a requirement when you do actually apply. We're basically trying to reach out to all those who are uninsured of all ages, and try to use any type of media in order to reach out and say that the marketplace is available. There is an individual mandate. Learn about it. Find out if it might work in your particular situation, and by all means use any of these resources in the community to actually see if you might be eligible for the assistance that our federal government's providing.